Hello everyone. For today, we have with us a very special child who has just visited our department. This child is diagnosed with Down syndrome, yet she stayed unfazed throughout her treatment. We truly enjoyed the time that we got to spend with her, helping her explore what a pediatric dental setup is all about, provide her with the best dental care possible, and making sure that we instilled a positive dental attitude in the child, so much so that she looks forward to regular dental checkups in the future.
In the following video, we will be discussing what all a dental healthcare provider should be doing during any child's first dental visit, the tricks and tips incorporated in making the child more comfortable and receptive towards dental treatment in the future. Establishing communication with the child is the first and most important step to establish a good rapport with the child. In this case, the child was quite amenable and happily greeted the clinician. She cooperated well, sat on the dental chair all by herself, and listened to all the clinician's instructions. Once on the chair, the child is made familiar with the entire dental setup. The use of the classic tell show do technique to make him familiar with the dental armamentarium in association with the use of euphemisms are employed. Euphemisms are the use of words which the child is familiar with based on his mental age. For example, an air rotor becomes a shower, a suction becomes a straw, and a three-way syringe a water gun, and so on. All these methods comprise the non-pharmacological behavior management techniques. Pharmacological behavior management techniques employ the use of nitrous oxide conscious sedation, which has been a boon to the world of pediatric dentistry. It uses several, and it can also be used in adult patients to lower anxiety. Nitrous oxide is excellent at reducing anxiety. It is used as a minimal sedation wherein patients respond normally to verbal commands. However, cognition and coordination is slightly impaired. Even the most cooperative and the most well behaved child can lose interest if the treatment time is prolonged. The operator should keep the treatment as short as reasonably possible. Oftentimes, children are reluctant to accept treatment come what may, even after using all behavior shaping techniques. In such situations, the clinician must adapt and present alternatives to the treatment plan that he had in mind previously. For example, if the child is unwilling to accept the use of air rotor, like in this case, efforts are taken. Positive reinforcements are used in the form of gifts like offering a star. Even when this fails, the use of interim therapeutic restoration is employed as an alternative and the patient is kept on follow up thereafter. In this case, when the child was reluctant to accept the nitrous oxide mask, she was offered a star and a brace. Quite intrigued with the offer, she puts the mask back on all by herself. Parental presence and absence also plays a huge part in the child's behavior on the dental chair. This technique can be used as a positive reinforcement technique based on the child's behavior. For example, parents are asked to leave if the child misbehaves or shows reluctance towards treatment, whereas good behavior will be rewarded by making the parental presence evident. There was this one famous quote by McElroy in 1890s who stated that although the operative dentistry may be perfect, the appointment is a failure if the child departs in tears. The goal of any dental treatment should incorporate an overall holistic approach that takes into mind the treatment of the whole patient rather than just the symptoms of the patient. A good clinician isn't the one who knows how to treat each and every tooth, but the one who knows when not to. One should even be open to modify the treatment plan mid treatment if it prevents mental trauma to the patients. Having a long term vision goes a long way in providing optimum treatment for an optimum oral health in a child.